All right, we're going to get started here. Thanks everyone for joining yet again for our monthly webinars. For anyone that's new, we do this on a monthly basis, giving information on what's going on in the current 340B landscape. I'm Justin Rowland, the Vice President of National Sales. And thank you all for joining. The people who've come month in, month out, we appreciate your continued attendance to these webinars. So it's 30 minutes. We're going to go through, we're going to change up a little bit this month. Anthony and I are kind of going to work this together, mostly Anthony, but I will be piping in myself. And we always want to interact with you. So please ask any questions in the chat box when the webinar is over. Anthony and I will address those questions and get your answers. But once again, we appreciate your attendance. And I'll turn over to Anthony Velasquez.
Justin, thank you very much. My name is Anthony Velasquez. I'm the Chief Product Officer here at PharmaForce. I'm really excited about this topic. Justin and I both come from the covered entity prior to joining the third-party administration side. Obviously, we're now on the third-party administration side, but we both have deep experience, years of experience working for the covered entities. And given the environment right now in the covered entity space and the manufacturer situations and many bills being discussed in Congress, I think it is a very timely topic to help covered entities understand how they can make a case for their 340B program. How can we educate lawmakers? How can we educate sometimes our senior leadership and C-suite on the value and the importance of the 340B program to the covered entities? So we're going to spend the next 30 minutes talking about that. Justin's background as a CFO for grantees, I think it's going to be critical to sort of hear his perspective and his experience, and also my experience in being the 340B manager, 340B coordinator at multiple grantees and hospitals prior to joining PharmaForce. So I hope that you enjoy the topic. It's going to be a lot more lighthearted than some of the manufacturer discussions and manufacturer exclusion stuff that we've done in the past. But I think this is going to be good, and I hope that you find a lot of value in it. So let's go ahead and get started. Quick disclosure, nothing in this presentation should be constituted as legal advice. Just have to get that out there, get that out the way. And then the agenda for today, we are going to talk about, number one, quantifying your 340B program. I know that might sound simple. There might be some of you that are veterans, have been doing this for decades, know this stuff in and out. But there's also a lot of new people. I meet a lot of you at the conferences. I get LinkedIn messages from people that are just pharmacy techs that are applying for their first 340B position and want tips on how to do well in the interview. And I love talking to people in that scenario, because someone gave me a chance over a decade ago to start my 340B journey. So for those of you that are new, and perhaps some of you are the first 340B coordinator or manager at your current entity, maybe you just went live as a 340B covered entity. We're seeing some of those on our third-party administration side. This would be very good information for you. We're going to talk about patient and community benefit, why tracking that is so important, and what exercise you can do to track that. We're going to talk about the impact profile. This is something that 340B Health has been sharing, and others, for a really long time. And I think it's really important for covered entities to sort of go back and put something together that tells your story. And we're talking about, telling your story and to whom. That's really important, of who needs to know about the importance of your 340B program. And lastly, I want to share something that I think is related to the topic, and that is some of the movements at a federal level and a state level on new reporting requirements. There are some states that are approving bills, wanting to know some of the things that I'm going to talk about in terms of quantifying your 340B program. That looks like is getting some steam. And I hope to share some new information with you and help you be prepared for that if and when it comes. All right, let's go ahead and start with topic number one, and that is quantifying your 340B program. This is so important. I can't stress how important this is. Having been the first 340B FTE at 3 different covered entities in my career in the 340B space, I can tell you that this has been critical in ensuring that I'm able to get the support from the C-suite, from the leadership, and from key stakeholders in the organization. So the question to you is, do you really know your net 340B savings number? Do you know that number? Can you easily get that number? Are you tracking and reporting that number? Are you looking at trends related to that number and how that might impact your 340B program? It's important to inform your key stakeholders, your pharmacy leadership, your C-suite, your board, because knowing this gives people that are not in the weeds of the 340B program, are not seeing the true benefit of the 340B program, are not in the third-party administration or looking at the invoices or looking at the amount of purchasing that the hospital or the grantee is doing, may not know how impactful and how valuable the 340B program is to the covered entity. I can tell you I've had those conversations multiple times where leaders of the organization had no idea that the 340B program was so valuable to the particular organization that I have been working for. And it was once we were able to share the value of the program, share how much it meant to the organization, to keeping the doors open to patients, the impact that it was doing to patients, is when I was able to gain support for additional FTEs, to attend conferences, to continue to educate myself and my team, and to grow, the 340B program support across the organization. Justin, would you add anything to that? Anything that you did at your entity around this and why this is important?
Yeah, definitely letting the board know, especially if you're a grantee, that what these savings are doing for you, and not just using those savings to buy a chair or do something specific with. Use it to grow your program and your total program, and so you can increase that access to care. Maybe that's hiring a new physician, maybe that's doing transportation services. Just using those funds, not just to purchase things, but to actually grow your reach as far as your access that your patients have to healthcare.
Exactly. Now, how do you do that, right? It's easy to say, do you know your numbers? But how do you do that? And that could take a long time to explain, depending on how big your entity is. But I try to put together a quick little graphic to help you, get to that number if that is something that you're working on today. Okay, so first you have purchase-based savings. That's what I'm going to call it. That's my term. And basically what I mean by that is you are going to look at all of your purchases across all your manufacturers and wholesalers, and are going to determine your gross 340B savings by taking all your 340B purchases, what they would have cost you at your group purchasing organization or your non 340B account, and getting the difference between those numbers. So, for example, if you're a hospital, a particular medication would have cost you $5,000, but it cost you $1,000 at 340B. That is a $4,000 savings per vial that you purchase. The second point to note that is really important to track as well as part of this number is your WAC impact. Again, this applies if you are a hospital subject to the GPO prohibition. So the WAC impact is, because you're in 340B, because you have a splitter, you need to have a WAC account for your first purchasing, so that it makes the 340B, the inventory neutral, and you are in compliance with the GPO prohibition. Now, that means that if you have a lot of WAC purchasing, that could be costing you a lot of money. So if you're buying something at WAC that's $2,000, but it would have been $500 at GPO, that is a negative WAC purchase. People use different, phraseology for it. I like to use your WAC impact of how that impacted your 340B savings calculation. So you got to take into account both of those numbers. If you are a critical access hospital, a sole community hospital, a hospital that's not subject to the GPO prohibition, that does not apply to you necessarily. And then you want to look at 340B only sites. If you have an operations where you have an infusion center and it only has a 340B account, that is easier to do, to go into your wholesaler system, download a report that looks at the difference between your 340B purchases and what they would have cost you at GPO. Okay. So once you have that number on your mixed use and your physician administered drugs, you're not done. Then you want to look at the savings on your in-house retail and wholly owned pharmacies. So in this case, you still have purchase-based savings. That is that, since you own the pharmacy, that revenue would have been yours anyways. But in this case, instead of you buying the drugs at a non-340B pricing, you're now able to buy those that are eligible at 340B. You want to get the difference of that, again, similar to the physician administered products. And the WAC impact still applies. There are some hospitals that have a high usage of employees using their retail pharmacy. Those employees may not be 340B eligible. That could lead to a high percentage of WAC purchasing. So you want to take that into consideration. There are strategies to handle that, to open employee-only pharmacies and things like that. There are some advanced strategies that hospitals do. But if you are a hospital, you want to consider the WAC impact in your in-house retail. If you're not, then that does not matter. That's not something that you need to necessarily consider. You're not done. Then you want to look at your contract pharmacy activity. Okay. So this is where you look at, primarily this information will come from your TPA. It will come from your invoices, where you are looking at the total paid, total reimbursement, minus dispensing fees, minus TPA administrative costs, minus drug costs, minus cash cards or sliding fee subsidizing that you might be doing, and you get the net 340B profit of that. Okay. Now you calculate those two numbers, you get a savings. Then you want to take out your operational and compliance. Apexis actually has a really good tool for doing this that breaks it down very, very well. And I use some of that information to put this together. But there's also cost that goes along with managing a 340B program, right? You have dedicated FTEs, you have software, you have legal, you have membership fees, you have conferences, consultants, auditing, et cetera. And all those costs sort of go into getting that true total net savings number for you to share with your leadership team and those key stakeholders. All right, so I know I went through that really quick, and I know that there are probably a ton of questions on that, but for the sake of time, I'm going to move on to the next topic. All right, next is tracking patient and community benefit. This might sound easy, but it is not. I have spent hours when I worked on the covered entity side, talking with our CFO, talking with the different leaders in the organization, trying to really track down a list of what are the patient and what are the community benefits that we are providing as a covered entity, and how can we write that down, jot that down, make sure we know, tie it to a cost, so that we can be able to say, if 340B goes away, these benefits will be directly impacted. All right, so I highly recommend that you do this exercise, okay, of sitting down with your compliance team, with your 340B committee, and looking at what are all the things that we are offering as a covered entity to our community and our patients, and noting that down and tracking that down and trying to assign a value to them. That could be things like charity care, uncompensated care, free or reduced medical services, free medications. I worked at hospitals where you could not leave the hospital without your medications, and we will give it to you for free if we had to. Sliding fee scale. Every single federally qualified health center grantee on this call knows exactly what that is, and are required to do that, and are doing that already and do a great job. Some of my most rewarding times working on the covered entity side were times when I could help a patient get a 90-day supply of their insulin or their high blood pressure medication for $10, $15, where in the past they were paying $200, $300, $400. I've seen patients cry right in front of me because of the value of the 340B program. And that's part of the reason why I'm so passionate about this program, is because I've worked on the front lines dispensing medications. Now I'm all the way in the back on the product side and building technology, but I've gotten to see, face to face the value of the program. I worked at a hospital. We offer free transportation for patients that needed infusions. And we were very proud of that. And that was really important for us to do that for the community. Worked at a hospital that did community outreach programs. So free education, free screenings, free health events. We had a Dine with the Docs event where physicians will take time to come and meet with patients and have a complimentary dinner with them and educate them on different topics and different support groups. So I could go on and on and on about services that entities provide to the community that sometimes are difficult to quantify, difficult to identify, but they are so important to know, to tie a value to them. In so many cases, I heard of a covered entity who actually created a separate 340B account for where all the 340B revenue will go to, and they will pay for these services out of that account to be able to easily track and keep a line item detail of the cost of providing all these services. As Justin was saying, adding physicians, adding dietitians, adding pharmacists, those are all things that are supported by the 340B program. Justin, anything else that you will add to that?
Yeah, I think so. If you look at it from of your uninsured population, so 340B, we're looking for help to help the uninsured and underinsured, right? And so what we did, we brought in specialists. So we bring them in once a week, once a month. They had to see our uninsured patients. We would pay for colonoscopies for uninsured patients, those types of things, help them with those preventive services. And so instead of, just bringing that money in and not really quantifying it, you can take it and put it to something like that, bring a specialist in, because the uninsured have a hard time getting in with specialists. We all know that. And so if you can help with that piece, especially if you're a grantee, if you can help with that piece, then that improves their life. It keeps them out of your health center for things that could have been prevented, going into it. And so I think it's something that a lot of FQHCs look at. I think it's a good program for their uninsured patients. Yeah,
right. I mean, that's a whole nother piece on its own, right? It's helping the uninsured, and all the great work that grantees do, and that is amazing. And my first 340B job was at a FQHC in North Philadelphia, where there was a ton of need and a ton of people who were uninsured, were cash paying, hardworking people that just didn't have access to health insurance. And we were able to help them on a day-to-day basis.
And Anthony, I'll say this too, if you look at it from a transportation issue, I was in rural West Alabama. And so a lot of people had transportation issues. If you could buy some vans, hire some drivers, help those patients, especially the elderly, those Medicare patients, those uninsured patients, still get to your health centers and be able to see the doctor. And hey, stop by the local contract pharmacy you partner with on the way and get their meds. Have a cash card program, and you're increasing your saving or your revenue by bringing those Medicare patients in, but you're also increasing your reach and bringing in new, unique patients, more encounters a year, and so you're actually using those savings to increase your own revenue in your program.
Right, and helping the patient stay healthy, by doing those things. All right. Great. Thank you so much, Justin. Now let's talk about an impact profile. An impact profile is now you're going to take all of these things, right? So you're going to document all these things that you're doing for patients already, and you just don't have it centralized, documented, organized, and you want to think through that. Then you want to put that into a concise, simple, focused document. Okay. And that's a strategy that 340B Health and other organizations will share. Credit to them, because I think they've pushed this a lot. And I'm sure other FQHC advocacy groups have as well. but I wanted to share because this is important if you don't have this handy. Again, the goal at the end of this webinar is that you leave here and hopefully take action in putting together this impact profile and putting together a list of the benefits and things that you're providing to your cover entity, to your community, in order to make your case for your program to everyone that needs to know the value of the 340B program to your community. Now, I want to start by saying it doesn't have to be complicated. Okay. If you did the exercise that we were just talking about, now you have a lot of key data points and a lot of information. All right. So what are some of the numbers that you want to highlight? Number one, you want to highlight your approximate annual 340B savings. We talked about that calculation at the beginning of the, in one of the first slides at the beginning of the presentation. That number is key because organizations in the healthcare space are already running on very thin margins. And that number, you can literally say, we will have to close a lot of services and departments if this 340B savings completely went away. Your payer mix is important. I worked for a grantee that had 80% of the patients were Medicaid or uninsured. 80% of the patients were Medicaid and are uninsured. So your payer mix or your DISH percentage might be a key metric. If you're a DISH in an area where you're at 30 plus DISH percentage, you're nowhere near the threshold and you're very needed in that community. Amount spent on pharmaceuticals, that could be a number that could be helpful in getting your message, your clear message on why this program is important. Uncompensated care, as Justin was saying, distance from your hospital to the closest safety net hospital. That's an important thing that you might want to know of. Hey, we don't have great patient access in our area, and if 340B goes away and our hospital has to shut down, you're really hurting constituents. You're really hurting the community. Another really key point that I have not seen anyone mention, but I thought a lot about this is post-COVID, the operational costs of running a grantee, an FQHC, of running a hospital has increased significantly due to the cost of labor, where you now have to pay nurses a lot more money, physicians a lot more money, and other support staff, that have either left healthcare altogether or have had so many travel opportunities open up that, healthcare organizations are really hurting right now on that operational cost side and running normal day-to-day business that was probably a little bit better pre-COVID. Be concise, highlight relevant points. Don't make it too long. Don't make it read, like a textbook, but instead just be straight to the point, highlight the value, highlight the benefit. What are the most critical programs that you're providing? What's the positive impact that the 340B program has on your community, and emphasize commitment to transparency and compliance. I think those are all very key points to consider in your impact profile as you're building this and putting this together. Justin, anything else you will add to that?
No, I agree. Be concise, but tell your story. It's pretty easy to say I had $100,000 in net income last year. My 340B savings was $300,000. I'd be negative $200,000 without it, and the hospital couldn't exist. There'd be no ER within 30 miles of our hospital. It's pretty easy to tell your story if you're concise and using those savings versus what your net income is.
Correct. Yeah. Everyone knows 340B in theory, but when you get down to the nitty gritty, when you get down to those numbers that show if 340B goes away, we're toast. We have to close. And there are many cases like that, especially in rural healthcare. In rural healthcare, the 340B program is so critical because it is very difficult, very expensive to get someone to hire a physician to go, to the middle of rural America. It's expensive, and all of that comes with cost. And the 340B program really help, stretch those resources as it's intended to do.
And also, I'd say, but you need to have a TPA that understands that too, and cares enough to help you keep your program not just compliant, but maximized as well. They should be helping you maximize your program, and not, they should be communicating, if not weekly, monthly.
Right. No, I totally agree. Totally agree that And we mentioned that one of our other webinars, we talked about the role that a good TPA partner plays in all of this, working well and being able to maximize your 340B savings. All right, moving on to the next point, and that is telling your story. That is, who needs to know, right? So to whom? That is the important question here. Of now that you know your number, you have documented all the benefit, the great benefit that you provide to the community. You created an impact profile. Now, who do you need to convince? Who do you need to inform about the 340B program and its importance? Number one is your organization. It starts from within. You have to get the support, and you have to get those in leadership to understand the importance and and how the 340B program is so critical. I bet you your nursing director or VP of nursing probably doesn't know the important role that the 340B program plays in keeping the hospital operating, or your chief pharmacy officer, or hopefully that person knows, right? Because that's a really a role that's closer to the 340B program. But I mean, everyone in your executive team should have read your impact profile and clearly know how important the 340B program is, and be on board with supporting the 340B program in whatever way possible. This is first, and I can tell you from firsthand experience that this is easier said than done, because organizations can be very big, a lot of moving parts. Everyone's focused on their department, but it's very important to share the value of this program. I went through an exercise at a hospital I was working at, and no one believed how big the 340B program was in terms of the savings it was bringing into that hospital. Number two, the community, the public, and patients. These are supporters. These are advocates. These are people that can call your representatives to express support of the 340B program. These are cases that you can document of how the 340B program has helped the patients, which is truly the intent of the program, has helped patients improve their care, receive access to medications, receive transportation. So you want to find ways to inform the community. And inform the patients as well. Lawmakers in Congress, this is key, and probably one of the most important ones on this list, and that is to do advocacy days, to invite them on site, to share the impact profile, educate them, and knowing how many constituents in their district are being benefited by the 340B program your covered entity is managing and leading. I've heard many stories of covered entities inviting their representatives on site to tour and to see. We have this group of pharmacists or dietitians that are directly supported by 340B savings. We're only able to pay for their salary because of the 340B program. And I think they are so important, especially now when there's in the midst of the manufacturer exclusions. There's bills right now being discussed. The Senate has asked for, has done a request for information from covered entities. So it's more important than ever right now to make sure that lawmakers, your representatives, your local representatives understand why the 340B program is so valuable. You can do this via a newsletter. Maybe you send a newsletter to all of your patients. I worked at a grantee that did that. Articles. I helped a CEO at one of the hospitals I worked at write an op-ed supporting the 340B program and sharing why it was so beneficial and impactful to the communities we served. Maybe you post it on your website. I've seen entities post this on their website. Just post their impact profile. You can look it up on Google and find the impact profile of the covered entity on their website. I've seen some covered entities start a podcast actually, where they are talking about pharmacy and the benefits of the 340B program. Ultimately, be creative, get the word out, make sure that people know how beneficial the 340B program is to your covered entity. Justin, anything else you would add to that?
I know we're running up against the time, but on the FQHC side, it's not hard to get a House Representatives member to come visit you or a state representative to come visit you, but it's hard to remember to talk about 340B. You got those 330 grant funds that you're getting, and you want to, and it's always up for to take them away from you, and so you're always pushing that. Just don't forget about 340B. And send letters to your congressmen, to your senators, to your local representatives. I do every week about 340. They're tired of hearing it in Alabama. Tuberville, Katie Britt, they're tired of hearing me talk about it, but I keep it in their face. It's an easy email to send.
Yeah, thank you, Justin. Yeah, that's a good point. That's a really good point. Lastly, this is it. We're at the stretch, but this is really important. So you want to stay for this, because I think this is some new information that I haven't seen a lot of people sharing just yet, because it's very new. It's sort of been in some of the 340B reports recently. But there are some new reporting requirements that are being discussed. So what is this exactly? So there are federal bills that now include language regarding 340B reporting for covered entities, especially hospitals, where they are trying to introduce a way that hospitals would need to report on an annual basis their 340B savings and different measures and different key metrics related to their 340B operations. Not only is that being discussed at a federal level, states are also showing increasing interest in 340B reporting measures. For example, in Minnesota, effective April 1st, 2024, actually, I have a typo there, but effective April 1st, 2024, and Maine, effective January 1st, 2024, both of these states have signed laws with new reporting requirements. And those reporting requirements will include things such as 340B benefit, by payer mix, and a bunch of other things that are going to add some burdensome, requests. And hospitals will have to do this on an annual basis, at least from what they're saying. They're going to summarize this and post this on their website. Bills like this have been considered in other places, so Connecticut, Indiana, Virginia consider these, but they did not pass. It is believed that states are looking at Medicaid benefit to covered entities and sort of trying to quantify that number and perhaps coming out with bills and laws to try to get some of that 340B savings for the state budgets. That is what I've heard in the industry and read. I don't know how correct or accurate that is, but the fight doesn't just stop with your lawmakers in Congress and your representatives, but also with your state legislatures, of ensuring that they understand how the 340B program is positively impacting the state and your community. With that being said, I hope that this was helpful. I hope that you learned something today. We're obviously, as Justin said, we're here to answer any questions. We love engagement. If you want to come off mute and talk to us and help us understand something that we perhaps didn't hit on, or share your story, what you're doing in your state, we are more than glad to do that. It looks like we have a few questions as well, Justin.
Anthony, and just to add to what you just said, it doesn't have to be complicated on the reporting. I know it sounds daunting. There are some great consultants that could probably help you out there. But if you look at your charity care, I mean, that's your charity care is for your uninsured, right, for the most part. And so if your 340 program is 300,000, your charity care is 300,000, then use it, write it off to that, or and also all these covered entities, the FQHCs do a really good job of doing the cash card programs. The hospitals need to start looking at it. It's for the uninsured. Help them get their meds. Partner with independent pharmacies that out there that you can help them. Helps the pharmacy, but it also helps the patient. And if a patient walks into your emergency room for a sinus infection, they don't get their meds because they can't afford it, because you're not doing a cash card program at independent pharmacy, they're going to come back in your ER the next week, and it's $2,000 per patient is the cost there. You could keep them out by spending $10 on their meds or partner with that pharmacy. So just my soapbox, I could stay on it forever. But if we're going to advocate for 340B, you guys on the hospital side got to start helping it on the cash card programs.
Yeah, no, that's a great point. It's a great point.